Paediatric Gastrointestinal Endoscopy, European Society of Gastrointestinal Endoscopy, ESGE, and European Society for Paediatric Gastroenterology, Hepatology, and Nutrition, ESPGHAN, Guideline Executive Summary. Introduction. Gastrointestinal GI endoscopy in the pediatric population has evolved during the last 30 years, with an increasing number of diagnostic and therapeutic applications. Technological improvements in endoscope design and endoscopic devices have contributed to the evolution of pediatric endoscopy. Endoscopy in the pediatric population has generally to date been performed by both non-pediatric endoscopists in conjunction with pediatricians and by pediatric endoscopists in specialized centers. This document is the executive summary of the Guideline on Pediatric GI Endoscopy commissioned by the European Society for Paediatric Gastroenterology, Hepatology, and Nutrition, ESPGHAN, and the European Society of Gastrointestinal Endoscopy, ESGE. The aims of the evidence-based and consensus-based guidelines are to provide a comprehensive review of the clinical indications and timing of diagnostic and therapeutic endoscopy in pediatric patients. It is not meant to be a comprehensive overview of a patient's care, and investigation and therapy for each area will, of course, involve the clinician's discretion regarding the place of endoscopy in overall management, encompassing, as it must, complementary non-endoscopic approaches. The role of endoscopy in the overall management will depend on a number of factors, including but not limited to the specific clinical features, the availability and appropriateness of non-endoscopic approaches, and the available skills of the endoscopist. This guideline tries to address this issue of endoscopist skills, and certainly the upcoming ESPGHAN ESGE guideline on training in pediatric endoscopy will help in this respect. How, where, and when endoscopy may be employed in pediatric management is particularly important in the areas of GI bleeding and endoscopic retrograde cholangiopancreatography and endoscopic ultrasound, ERCP, EUS. This undertaking is the first joint endoscopy review between pediatric and adult endoscopy representative groups in Europe. The author's aspiration is that this guideline may lead to a degree of standardization in the utility and practice of endoscopic approaches for children, thereby contributing to excellence and appropriateness of care. Percutaneous endoscopic gastrostomy and endoscopy specific to inflammatory bowel disease, IBD, have been dealt with in other guidelines and are therefore not mentioned in the Pediatric GI Endoscopy Guideline. Training and ongoing skill maintenance will be addressed in an imminent sister publication. Both the guideline and executive summary were issued in 2016 and will be considered for review and update in 2021 or sooner if new and relevant evidence becomes available. Any updates to the guideline or executive summary in the interim will be noted on the ESGE and ESPGHAN websites, http://www.esge.com/ESGE-guidelines.html and http://www.espghan.org/guideline/.